next few here. So Obamacare is in the news. What's Obamacare? It's the Affordable Care Act. It was passed in 2010 to hopefully reduce the rate of uninsured in the United States. But what does Obamacare actually do? That is the question that many people frankly just do not understand, because the bill was over 1,000 pages and it established a lot. So before 2010, the insurance market was pretty much made up of private insurers and some government entities. You could either buy insurance on the private market through some health insurance company, or if you're poor enough, you could be on Medicaid, or if you're old enough, you could be on Medicare. But that system just wasn't cutting it. It wasn't insuring everyone. Less than 90% of the United States was covered, and health insurance costs were really, really high for the government and for consumers. One of the most important groups that wasn't covered were people with pre-existing conditions, people with asthma or diabetes or any other illness or disease that made health insurance more expensive. Health insurers just said, we won't cover you because you're too expensive for us. But that's obviously problematic, because those are the people that need health insurance most of all. On top of that, insurers could say, you know what, you're too expensive to cover anymore, so we're going to put a cap on how much insurance you could have. There would be lifetime caps, annual caps on your insurance. What young people didn't like before Obamacare was that once they turned 23, they had to leave their parents' health insurance, which would probably cost a lot more to them. So what did Obamacare do to fix any of this? Well, first they said, well, we want to cover all those people with pre-existing conditions, but they're really expensive, so we're going to have to make sure that everyone is covered. This is where the individual mandate comes into play. We're going to force almost everyone in the country to buy health insurance so that they're all paying into the system and sharing cost into the insurance market to bring down the cost of everyone's premiums to cover those people with pre-existing conditions. If you get enough young people to sign up, those are the healthiest, least likely people to use their health insurance, and therefore all the premiums that they pay can go towards paying for the people with pre-existing conditions. How can you best entice young people to sign up? Well, you extend their coverage from 23 years old to 26 years old. That's what the law did. But now how do you entice the rest of the country to sign up for health insurance rather than paying the penalty that the law establishes? First thing, to reach poor people, you expand Medicaid. That's a health insurance program run by the government that covers all poor people. So you raise the eligibility rates for Medicaid. But then there's people that aren't really poor but aren't rich either. How are they going to afford health insurance in this new state? Well, the government will offer them subsidies every single month to help pay for their health insurance and make sure it's never more than a certain percentage of their income. So that's basically the philosophy of the law. We expand Medicaid for poor people, we give subsidies to middle-income people, and the rich can still afford insurance. All these people can now afford and pay into insurance, bringing down premiums for everyone while actually covering people with pre-existing conditions now, covering people up till 26 years old, and having no annual or lifetime caps on coverage. In the next episode of this series, we'll discuss where the problems are that Obamacare ran into because of this structure set up by the law. For now, thanks for watching, and keep elevating the conversation.